to Medicine, Motherhood, and Missions, the podcast where we dive deep into our faith on this incredible journey of balancing a life dedicated to healing, nurturing, and giving back. I'm Johanna, your host, and each time we meet, we'll explore the stories of remarkable individuals who are PAs, doctors, and professionals, and mission-driven changemakers, from the halls of our hospitals to the hearts of our homes, and into the communities we serve. Join us as we uncover the challenges, triumphs, and everything in between through the lens of our shared faith in Christ. Whether you're a healthcare professional, a parent, or someone passionate about making a difference for God's glory, this podcast is for you. So grab a cup of coffee or tea, settle in, and get ready to be inspired by real-life stories of resilience, compassion, and dedication, all rooted in faith. Hi, friends. I'm so excited. Here today we have Denise Baker. She is a friend from Oral Roberts University, and we actually went on a missions trip to Nigeria together, and we had an amazing time. I got to get to know her a lot better. She was a nursing student at ORU, and now she is a nurse practitioner and COO at Primary Care Health Services in Pennsylvania, the Pittsburgh area. And so I am really excited about our discussion today about leadership, her journey to being COO as a nurse practitioner in a huge medical system, and discuss possibly the health disparities we see in different populations in that area as well. So thank you so much, Denise. Really happy to have you on the podcast today.
Oh, thank you so much for having me. I feel really honored to be able to be able to speak to you today, and I just feel really excited about our conversation and connection for sure. We did go to Nigeria together on a medical mission trip, and I remember you played the guitar, and you were so on fire for the Lord and in missions, and so just really happy we get to connect almost, I think, 20 plus years later. So really, really great that we get to connect.
I know, it's so nice. And and the good thing about social media is we can keep in touch, and that's how we've been able to keep in touch a little bit, see each other's lives a little bit too. And you have a wonderful husband who's also doing great, amazing things. And you have 4 such a beautiful, adorable little boys, and yes. Love seeing how they're just like growing to be strong kings in the kingdom.
Yes, thank you. Anytime I put pictures of them up or videos, I always hashtag Baker Kings.
Yeah.
And I remind them that they are royalty, that they are chosen by God, and that, they are important. So that's something that I, remind them of.
Yeah.
Yes. So thank you.
Yeah. And so tell us about your journey to medicine and being a nurse practitioner and how everything started.
Sure. So I think I had to really do some reflection. I thank you for giving me the questions ahead of time, because I had to think about some of these things and how did I end up here? So actually, when I was in high school, I didn't sign up, but I was enrolled in the CNA class. And I thought it was a mistake, and I got to the class, and I was like, this is, a mistake. I didn't sign up for this. But then the teacher, she was a nurse practitioner at the time, and she said, I don't know how you got in this class, but why don't you stay and see if you like it. Mm-hmm. And that was my first, experience in healthcare in general. And so I took the CNA class when I was 16, and I worked in nursing homes and hospital settings. I worked in home health as a CNA at a young age. Mm-hmm. And it was at that time I kind of learned how to, my bedside manner, how to talk to people. Yeah. And then I felt like really I really loved and enjoyed helping people. And even just in the most vulnerable state, I felt like I was able to bring people peace. And so that's kind of like how I got into nursing. But every time people asked me what I wanted to be when I grew up, I always said I wanted to be a doctor that delivered babies. I saw Bill Cosby, the show, when I was growing up, and I felt like that's, and every time I said it, everyone gave me this really beautiful response. And I was like, oh, yeah, I felt like, that's the thing to say.
Yeah.
So when I went to Oral Roberts University, I actually enrolled as a pre-med student. But it was interesting. It was my first week there. I was just getting my books and, just trying to get registered for class. And I kept on walking by the nursing department, and I actually didn't know what it was. There was no sign. There was something compelling me to go in. And so I went in and I said to one of the faculty, I said, can you tell me what department this is? I'm not quite sure, but I just felt the urge to come in. And she said, honey, you're in the nursing department. And I was like, I don't know why I'm in here, but can I ask you a question? And I said, this is what I want to do with my life. I would like to serve people. I would like to, do orders and write prescriptions and, perhaps work in a hospital setting. Could I do that as a nurse? And she said, yes, you can do that as a nurse practitioner. And when she said that, I felt so much peace. And I called my parents and I was like, I know I signed up for pre-med, but I really feel like I need to be a nurse practitioner. And my parents said, we trust you. And if you feel like that, then, you should pursue it. Yeah. And so I returned all my pre-med books and got all nursing books. I got accepted into the nursing program. I think that the next day I had to be interviewed. And I think that the difference between my pre-med books and my nursing books was 2 cents. So I gave them 2 extra cents, and I was registered in the nursing program.
Wow.
And so that's kind of like how I got into nursing, and I always knew that I was going to be a nurse practitioner. And so I pursued that, as soon as I could after nursing, after graduating as a nurse. So that's kind of how I went into medicine.
Yeah, that's really amazing because, at ORU, even I didn't even know about PAs or nurse practitioners going into ORU undergrad. Like you, I was pre-med, and then it's amazing but you were a nurse, so you had kind of a background in that field and working environment, and you had a nurse practitioner as a teacher before, so at least you were familiar. I had no clue. And then I found out about it. One of the physics professor's daughter-in-laws was a PA. And so that's how I heard about the PA profession at all. But it's amazing how, the PA and nurse practitioner professions are increasing and becoming more competitive actually to get into, just because there are a lot of benefits in practicing as those specialties. But so how did you end up in primary care health services and like your journey to becoming a COO?
Yes. So I moved to Pittsburgh. My husband is from Pittsburgh. And so we both met each other at Oral Roberts University. He was studying New Testament and I was studying nursing and missions. And so he brought me to Pittsburgh, and I started, everyone told me, like, when you become a nurse, you should do some time in med-surg. So I started at Shadyside Hospital, which is a very prestigious hospital in Pittsburgh, in their med-surg, and I absolutely hated it. I did not like it at all. I felt like it was just, it was always short. Yeah. They were always shorthanded. I just remember dreading to go to work, and I was like, God, like I went to school, I did all this stuff to be a nurse, and I knew I was going to be a nurse practitioner, but I was trying to like pay my dues and be med surg for a little while, and I did not like it.
Yeah.
So it was interesting. I ended up leaving, I think maybe 6 months into the job. And I remember the University of Pittsburgh hospital is such a large hospital in Pittsburgh. And I remember when I gave my resignation, one of the head nurses or the managers told me, she said, if you leave here if you leave here, you're going to be blackballed and you won't be able to work anywhere in Pittsburgh. Like, what? You shouldn't, like, she was like, this is a wrong decision, and I was 22 years old and I was just like, this is the decision. And I was like, I'm leaving. And the crazy thing is I didn't have a job lined up, and she's telling me like, if I leave University of Pittsburgh Hospital, like it's going to look bad on my record or something, and I won't be able to get a job. And I left without a job. And the very next day, I interviewed at Primary Care Health Services at 22 years old, and I got a job that day. And I got a job offer, and I ended up taking home like more money than I did even at the hospital because of all the fees and the parking and everything.
Oh yeah.
I just think like she told me I couldn't get a job, and I was in work the very next day I got a job, and I started maybe on that Friday. Like I started immediately.
Yeah.
So I started at Primary Care Health Services as a new grad nurse, and I became a nurse manager in one of their sites. And that's kind of like where my leadership sparkle started to emerge, because I went into every situation and I always looked at process. And I always tried to figure out, how can I improve process? How can I make it more efficient? How can what can I do to make this run better? And so I started off in one department, and then I did well there, and then they sent me to another department. I did really well there, and then they sent me to one of the worst sites that they had at the time. And I remember the staff, I guess like maybe 5 nurses, the staff ran 5 nurses out of the facility or something. And there was a bet, there was a jar, okay? There was money involved. And they said, how long will it take for Denise Baker to be out of here?
Oh, wow.
And I went there, and I found favor. I helped improve, I helped improve process.
Yeah.
I was the nurse manager at 22 years old, leading people that were, twice my age. And that site became better while I was there, and they didn't win the bet. I was there for quite a long time, serving that community, serving the staff there. I left not on bad terms. I left to become a nurse practitioner. And I got a going away party, and it wasn't, good riddance to Denise Baker. So that was kind of like where my leadership first emerged. And so, and then I remember coming back years later and seeing I had some processes that I, put in place there. And I saw my paper, my task list still there years later. And I thought, wow, like the process and things that I put in place are still happening years after I've gone.
Yeah.
So I became a nurse practitioner. And then I saw the medical director from Primary Care Health Services, in the community. And he said to me, hey, Denise, I know you're a nurse practitioner, but I'm working at another health institution. And I really need your managerial experience, your expertise. That my nurse manager is gone. So I'll actually create a job for you. Can you be the nurse manager and a nurse practitioner? And I went and visited the facility, and I just felt led to accept this position.
Yeah.
And I remember a colleague of mine, she was a new nurse practitioner at the time, and she said, Denise, you know that this is like a demotion. Why are you becoming like their nurse manager? That's something that you've done in the past. And like a nurse practitioner, you should just be a provider.
Right.
And I was like, but I have skills in this, and I think I know what this organization needs, and I actually like really love like improving process. So to you it's a demotion, but to me it's an opportunity.
Yeah.
And so I remember being there for some time, and they put me at that time, the nurses and the medical assistants in that particular health center was there's the most transition and the most vacancies, like just people couldn't stay.
Yeah.
And when I was there for 5 years, and I had the most stable department in the organization. And the CFO said, "What's different? What's different?" My first year there, he goes, "Something's different. We saved over $100,000 in immunizations this year. Who did that?" And it was me. It was me, because I was improving process with their inventory and improving process with their medical supplies. And so I those are kind of like where my leadership started to emerge. And then because of that, God just started opening up doors for me in other institutions. And that's kind of how I landed in as a COO. So someone thought it was a demotion, but I was actually just operating in my skill set, operating in my gifts. And then it made room for me. And so now, that's how I kind of landed as a COO of another health center.
Yeah. I think I have to go back to some of your key points here, because, the nurse who tried to scare tactic you and saying you'll never get another job, people will come into your life speaking negativity or trying to scare you out of going after what your heart really feels you're led to, or where God is leading you to. And I'm so glad that you were strong to realize that it doesn't matter what these people are saying. I know where God is leading me, and, He will always take care of where I need to be. Right. And, and then even seeing how, it is true what, your, nurse practitioner friend was telling. Sometimes I can see how she was probably saying it. It seems like you're going back into a nursing role, but you knew that you were going into your skill set and a leadership opportunity that would help the facility, help the patient population. And I think that's key, because you were thinking on a broader scale and a different perspective, and I can see that that's your heart, is to help the patient population more than just having some kind of prestige in what you're, the title, you know what I mean? And so I think that's what I can see, is that you saw the needs to help the patient population more, and how you can use all the skills you have for that patient population, and make a better and grander impact. And I think that's amazing that you stood strong in what you knew, what your strengths are. And that's important, and such an important thing for all of us to, realize and stand strong in.
Oh, thank you. I think one of the reasons why that department became stable is that as a leader, not only did I help improve processes, but I really poured into the staff. And so I remember, sitting with them, one of our first meetings, and they all kind of, was trying to tell me, like, this is how things will run. Like, kind of like, who do you think you are? When I came in to that institution, and I was able to disarm them, because I studied them for a couple weeks, and I sat down and I said, I know that you don't know me, and I'm a new leader here, but I want to tell you what I see in you. And I went through every staff member, and I just kind of pointed out their strengths that I saw. And I said to them, under my leadership, some of you will not be here because some of you will pursue more degrees and some of you will get better jobs. But my hope is that you will be better because of what I could do for you and how I want to serve you as your leader. And that immediately, I gained their trust. I helped produce better culture and in that institution. And many of them did do that. Many of those medical assistants and nurses went on to, go back to school and to do better and greater things because I just simply took my role as seriously as to really pour into them. Yeah. And so that is, not only do I try to do that for my patients, but I try to do that to the people that God has me over or that I have influence over. Yeah. And so I think that's kind of like my approach, which is why I feel like there's stabilization that comes from that approach.
For sure. Servant leadership. And when using or encouraging others' strengths, seeing where they are strong and honing in on that. And because some people, working in healthcare, and you see a lot of different clinics or post-acute care or hospital settings. Every setting is so different. Every employee is different. And sometimes in these settings, you don't get those encouragements. You don't get the positive feedback. And you're just constantly berated, constantly, this is not right. This is not right. We need to change this. But speaking that positive, changing the atmosphere, I can see how that would make such a huge difference in the facility and in the program. Yeah.
I would also say I never go into a new setting trying to change things. I always go in trying to be a learner, trying to understand what exactly they do, following, even the medical assistant or the maintenance staff to see what they are doing so that I could understand. I do a lot of gathering of information before I implement anything because they have to know that I understand their day-to-day in order for me to change anything. And so I think that is something that every new opportunity that I have, every new responsibility that I have, I try to understand where they are at, and I try to learn first before I say anything. And I feel like that has helped me, be successful in transitioning, one department, at a time.
Yeah, that's amazing. And so many important things to learn from that example of leadership. And then talking, also about the primary care health services system that you're part of. I was earlier we were talking, and I was looking at how it was founded and the amazing history that it has, and also an important thing is, working in that primary care health services, you're working with a patient population that does have challenges to access to health care. Tell me a little bit about what you've seen in equitable healthcare access, and what are the challenges, what has improved, what needs to continue improving.
So I work for a federally qualified health center in Pittsburgh, and we have 10 locations, and our locations are very strategic in its placement because it's placed in places where the socioeconomic status is low. It's placed in places where people really do need an access point to healthcare. And most of our patient population are African American, Black and Brown. We have some refugee patients, some just a diverse population, but and they are underinsured, not insured. Our institution also has a homeless healthcare component where we go to homeless facilities to help bring access to care to them directly. And so, with that, when serving, the least of these, we seek to serve them with dignity. We seek to serve them with respect. We seek to serve them with with highly equipped physicians and providers that do excellent care. But we understand that that there are specific needs that they may have. So, how could I talk to a patient about their diabetes, but they don't know when their next meal is going to come? And how can I talk to them about, checking their blood sugars when they don't have lancets and they don't have alcohol pads? It's like we have to kind of address social determinants of health before we can sometimes even tackle the most basic healthcare needs, because our patients are not just one compartment or one facet. They're a whole being with so many different needs and that needs to be addressed. And so we're trained and equipped to address all of their needs. We have social services, we have behavioral health, we have that we can try to give resources and wrap around our patients and families so that they can have those basic necessities. And then we can address, their yearly checkup and their eye exam and their mammogram. And maybe they don't have transportation, so we help them provide transportation to get their mammogram done. So there's so many things and facets that we are trained to address. And so it's a little unique, in that we, that we have to look at the whole person and not just, like a private practice or some maybe patients who may have all of those things checked. And so, I can think about a particular patient who was new to Pittsburgh. She was in a domestic violent relationship. She was really seeking companionship. And she went to one of our clinics and she saw me as a patient. And, I talked to her about, getting her mammogram done. But then she was so heavy with, being beaten by her husband, that was kind of difficult for her to talk about just getting a mammogram. It was, her needs were so deep. She stopped by the clinic several times, just not even with an appointment, just to talk sometimes. And she would wait in the waiting room and ask for me, like, and I would talk to her and kind of chit chat with her. Yeah. Eventually, I got her to get a mammogram, and she had her mammogram was positive, but positive for cancer, but it was very treatable. And she said that the radiologist and the person that did the testing said, whoever told you to get a mammogram, they saved your life because you have something that's treatable. And if we do something now, then you won't have, the residual. And I remember her coming back and just being so grateful to just that she got the test and that she was able to receive treatment. But it took several times talking to her. It wasn't that I just gave her the script. It was several conversations. It was several engagements. It was getting her a voucher to get transportation over there. It was a lot just to even get the test. And so these are how we are trained to help our patients. And so this is the kind of care that we provide at our, our institution.
And that's amazing because that's going the extra mile. That's going above and beyond to, really see how we can help the individual without just, here's the treatment, here's the diagnosis, this is, see you next time,
Yeah.
And so that's amazing what you're doing and what your system is able to do for that patient population, because that's exactly right. Because how do you treat a patient with diabetes when they don't have access to appropriate, food sources or healthier choices, and or even uncertainty about their meals, or let alone if they're an insulin dependent patient, how do they afford the cost of insulin? All those things that you mentioned. It's a complex situation. And how are we, I know your system's doing amazing, but sometimes it's really hard to reach out to all these people who are facing these disparities in healthcare access. And how are we, able to further improve in our services? Given your experience with your system, how can that be implemented elsewhere? Or,
Yeah. I'll say that, our institution is not perfect, and we have ways to improve because the need is so great.
Yeah.
And so, you're talking to me actually at a conference where we have all the federally qualified health centers in the state of Pennsylvania, and we're all kind of convening to kind of share our nuggets and share what we do and what they do to help us, to serve our population, our unique population that we serve. And so there's always room for improvement, but I think really just doing a social determinants of health screening on our patients, you find out a lot. Homeless doesn't mean that the definition of homeless. It's interesting. Like patients who are sleeping on someone's couch, they're homeless. You know what I mean?
Yeah.
But I even have to tell them, like, if you don't have a residency and you're staying at a cousin's house on the couch, you are homeless. I am. Yes, you are homeless, and you need housing.
Yeah.
But that social determinant screen is such a useful tool to kind of get a baseline to see, how you can best serve your patients, whether it be transportation or food, or, a patient can dress really nice, but maybe they don't know when their next meal is coming. You never know when people have, issues. And so those are some ways that we can kind of help to kind of understand our patient a little bit more.
Yeah, it's a huge topic and a challenge, and across the U.S. and globally, of course, but just the U.S. alone. Since we're talking about that, I have definitely seen this as a real challenge, and something that takes a lot of effort, a lot of people, a lot of teamwork to help with. It's amazing to see what you and your health system is doing, and I applaud the amazing efforts you guys are doing for your patient population. And going back to, process implementation and, being able to implement all these things, how would you define a leader?
So I think we mentioned like servant leaders, right? I think leaders is an individual that can help get a group from A to B. I think they are vision casting. and they are empowering and being their group's cheerleader. And I think leaders can come in different packages and with different gifts. And it doesn't have to be the very outspoken person that's the leader. I'm actually an introvert. So in nature, I don't necessarily like to be up front. But I think that I respond and I'm motivated by the need. If I see a need, then I feel like I want to address that. And if I have the skill set or the know-how to address the need, I feel like I'm activated. And then my leadership is activated. And so I think leadership can come in all different packages and with all different personalities. So I think that's maybe that's my definition.
Yeah. Yeah, for sure. Servant leadership. And I think, yeah, as you said, going with your strengths, I think there's a leadership, growing leaders that I was able to get involved with for my nonprofit. They have this term and or way of thinking is that everyone is a leader because everyone has a sphere of influence. So you're going to be leading someone, but are you going to be leading them to good, positive outcomes or, not so good, positive outcomes? And so you just, everyone has a sphere of influence and a level of leadership. That level of leadership changes based on where you are and what you're doing, but you definitely need to focus on the strengths and think about servant leadership. I love how you're really living out that servant leadership through what you do and how you're improving processes through that methodology. It's really amazing. And what traits would you say are key to being an effective leader? Maybe this is going around and around the same way of saying the same thing, but
I think I mentioned earlier you can always learn from anyone. So you can learn. I think learning from anyone, listening is key. And then I just think that I think you can't be afraid. At that point, you've done your you've done your listening, right? You've diagnosed the situation, and then you have to then you have to operate and you have to have action.
Yeah.
I do think that leaders, we can have a tendency to burn out, and so I think that leaders should create some margin for creativity because creativity can help. Help increase and improve culture and then innovation in an institution. And so you can't just be running so much that you kind of always in survival mode, but you have to be able to take a step back to kind of see now what's next for this institution or what's next for my department or what's next in my sphere of influence. And so I think I would say a leadership trait would be listening, gathering information, but then not being afraid to then act, right? And then also providing yourself an opportunity and an environment for you to thrive in your leadership is going to be, important so that you can sustain the pace that you're in.
And I think underlying to that is in order to create those creative spaces for you as a leader, you've got to be able to let go of things and delegate in order to create. And so you've got to have that trust with your counterparts and everyone around you to enable that system to be implemented so that you can have that time. Otherwise, sometimes it seems like leaders tend to have control over everything. Yeah. They don't want to let go of that control, but learning to trust and give away enables you to be an effective leader too, right?
Absolutely. I think you hit it on the nail there. I mean, there's been some departments that I helped develop But then after a while, then you have to take a step back, and then you have to let them, your staff run that. And I'll tell you, sometimes they run it way better than you do, and you're just like, that's the mark of a true, like, oh, I've done my job. When they do it better than you, it's like, I've done my job. And then sometimes they may not do it better than you, but maybe they do it a different way, but they still get the same results. I'm good on that too. Like, I feel like you can't get lost in the nitty gritty, and then you lose focus on the big picture.
Exactly.
So, but yeah, I think delegating is important. And knowing when to delegate and when to empower, and then move to the next thing. So yes.
Yeah, exactly. And so you've got an interesting background, being a nurse practitioner and now chief operating officer at a medical system, which is, I feel sometimes is not very common for a PA or a nurse practitioner to be in those positions of leadership. Do you feel that way, or do you feel like advanced practice providers are given opportunities to be in positions of leadership?
Personally, I feel like I'm seeing more and more nurse practitioners and mid-level providers and PAs in these types of roles, especially in the nonprofit sector. And I just think that we have a unique vantage point because we are providers and we are not out of touch with, what that patient care looks like. And so then when we advance into these roles, we have just a unique view on things, and we help the institutions run better because of that knowledge, as opposed to just having a master's in business administration and not having any kind of clinical background. There's a little bit of a learning curve, and I'm not saying that it can't happen, but but it is interesting. I do also have a learning curve when it comes to, I had to sit down with finance and learn how to read financial reports. But I always had a niche for data though. So I started off as their quality manager, and I ran data for all of our, UDS measurements, which is kind of like our measurements that we look at for patient care. So like our mammogram screening and our colonoscopy screening and our fluoride varnish screening. Like I looked at broad, numbers, and it was those data points that helped me understand the institution in a different light, that gave me the confidence to say, okay, I could do operations because I feel like I understand some of these things, and it just creates just a better flow. So like when providers are talking, I understand like their day to day, and I understand what we're asking. So it's like I can advocate for both, roles. But I have seen many nurse practitioners and PAs stepping into roles as that I'm in, and so I'm excited for our profession. I'm excited that that we are looked at as leaders in our institutions as well.
That's amazing. Yeah. And that's so true, because sometimes having that clinical and that patient touch as a leader in these higher level of leaderships allows you to be able to really know how to serve the patient population better. Yes. For sure. And sometimes it feels like PAs and nurse practitioners get so lost in I'm just treating and being a provider that sometimes maybe they're not thinking about those opportunities to serve at higher levels of leaderships too. But I'm glad to hear that it is increasing, and that there are APPs who are motivated to do those leadership roles. It seems that sometimes we may just think of ourselves just as a provider and not trying to see how we can, look at these processes, look at these systems, and that we often complain about instead of thinking like, what can I do about it? How can I help the system better, right? And so, So, I love your heart, that it's to serve others. And you have mentioned how you do intentionally serve others through your organization. But how are you intentionally serving others exactly and practically, if you can describe that? And how do you teach your children about that intentional serving and service to others?
How am I serving? So I think I serve my patients. I try to do, the very best I can with what I'm given. But I do try to instill the same principles with my children, and I'm active in my church, and I teach children's baptism class, and the foundations of their faith before they get baptized, and I try to serve in my church. I try to serve in my community, and sometimes I'll bring the boys to my job, and I have them picking up litter in the and trash outside.
Yeah.
I want them. I don't want them to be out of touch with our community and how to serve.
Yeah.
I think I shared with you. I was walking out with my son at my job. We were going to a doctor's appointment, and I brought him I had to pick up some things out of my office, and I brought him with me. And I walked by one of our patients who was trying to get in and needed a wheelchair, like they were kind of struggling with their walker. And I said, I told my son to get the door, and we got the wheelchair for him, and we helped the patient into the building.
Yeah.
But then I got in the car, and I just turned around at my son, and I said, anytime you can help someone, even if it's inconvenient, you should help that person. If you have the ability to help someone, you should do it. And he just said, yeah, he looked at me and said, yes, ma'am. And I was happy we were able to help that patient.
Yeah.
And so I think, those are some of the principles I try to instill in my sons. I see the fruit of that and how they treat their neighbor and how they, how they serve others in our community as well. And so I try to model that for them, and I do see fruit of that in how we parent them. So.
Yeah, that's so true, because we can get so stuck in our bubbles that we lose perspective of what's around us and our community. And and that's kind of why I started this podcast too, is, to encourage those perspective changes and discussions with so many people who have, so many different journeys and experiences. And I think as Christians too, like, when we serve, we're shining and sharing Christ's love with others, right? And that's the whole purpose of following Christ, is to share the love of Christ, which is in action and deed, not just in word. And so that's so important to keep remembering. It's not easy when we're busy and in a rush and trying to get from A to B. But yeah, we have to intentionally make those times and efforts. And if our children see that, that's so much more beautiful, because then they grow up to be the same. And that changes the generations going forward too.
Yeah.
So how do you and your husband, speaking of busy lives, how do you and your husband manage balancing life, work, and kids right now?
It's a little tough right now. My husband just, he got a new role. He's a vice president of a local seminary here in Pittsburgh. And he also is completing a PhD, and he also serves as a associate pastor in our local church. So he has like 3 jobs, and it's a lot, because I have some active boys too. I have 4 boys. I have 3 soccer players. The baby plays soccer. He's and I have 1 basketball player. And all of them play an instrument. And it's just a lot to they're high capacity people as well.
Yeah.
So I think that I just do my best to juggle their schedules. Sometimes we have to say no to certain things. And then when they get in the car, we have some, traditions that we do. What is your high? What's your low of the day? They share their highlights and maybe their lowest moments, and I'm able to get a lot of information from that conversation, and they look forward to telling me about that. We do a weekly almost like a business family meeting. We try to do that once a week, and then we do a family devotion once a week as well. And the boys do like a morning devotions where we do some affirmations, and we we memorize scripture in the morning. So it's like built into our schedule, but it's definitely, a lot to juggle, especially with a busy dad and a busy mom. We have a support system. So we have grandma and cousins and people that help as well. And then we always do a family vacation, and then we do a mommy and daddy vacation once a year.
Fun.
To kind of refresh and regroup, and just to all the hard work that we put in the year.
For sure.
We try to make sure that we have some times of rest. So it's not perfect, especially now that my husband has this new role. But all of these things are good things. And just kind of God has given us the grace to navigate all of our responsibilities. So it looks a little different. So I'm at the conference now, and I think it took like 3 family members to handle the boys this afternoon, and I'm like, oh my goodness, I have the Ring camera, and I took a look, and there was like 5 cars, and I'm like, oh my gosh, it's like all these people trying to help us. But I say yes to any help I can get. Any meal, any help. When people say they want to do something, I say yes. Thank you.
That's important. Accepting help. That's so hard for some people to do, but it
was hard, but I say yes
so
now.
Needed. We have to. And I love also how in the beginning of the conversation you mentioned you call your kids the Baker Kings. And I think that's so important, is speaking those words of life over our kids and to them, because in this world they'll hear all sorts of negative stuff and judgments, but when they hear those positive words of life from their young ages, that builds them up and hopefully sets them on a foundation that can stand strong no matter what comes their way, right? And I think that's also such a beautiful thing that you're doing for your boys, and something that is so vital for children these days. And how would you encourage others to be more effective leaders?
I think that community helps with your effectiveness, like getting talking to other leaders, like-minded people. I think I wrote down some resources that things that have impacted my leadership, or books, and one of them was just like the documentary of Mother Teresa. I just love studying her life and how she was a doer, and she responded to the needs that she saw in her time. And like some of my favorite quotes are from her. But also one of a life-changing books that I still recommend to this day, and people are still, I'm still seeing, benefits from this recommendation, but A Cure for the Common Life by Max Lucado. I read that before I went to nurse practitioner school, and it gave me the courage to apply. Like, I think I was like, should I apply or should I not? And then I read that book and I applied, and it just helped me understand my gifts and my talents, and helped me be confident in my next decision. So that helped me. And then 2 books that I read later on in my career that just helped me as a mom, as a leader, like, understanding my motherhood and my leadership were Becoming by Michelle Obama. That was an instrumental book because she describes a story where she went on an interview and she had to bring one of her girls to the interview because she couldn't get a babysitter. And she said, I could do this job, but you're going to have to take me as I am. And she got the job and like she did a wonderful job, but she embraced that she was not only talented, but she's also a mom. And so that made me help me embrace my motherhood and my leadership. And also there's another book called You've Been Chosen by St. Marshall. And she's another mother leader that was instrumental like in this time in my life, just to kind of, I'm not the only one out here with kids and trying to serve serve in this capacity. So I think those are things that has helped me, and I hope that can help someone else as they are leading.
Yeah, that's so beautiful and so amazing. Like, to accept me as I am. I love that. You're a working mom doesn't, it's a combined thing. Working mom, you work, but you're a mom. That will never ever stop. That's your, full-time job after your full-time job.
Yes.
So,
that's always in the front. Yes.
Yeah. And so, but that's amazing. Any last few words of advice and encouragement for those listening?
I think I would just, I just want to go back to leaders don't kind of maybe look like what you might think. And so I would like to encourage, someone who may be feeling like maybe you don't think you're a leader or maybe you don't want to step into a leadership role, but maybe God might be opening up doors for you in that and you kind of feel intimidated by that. And I would say that I would really ask God, to really show you what to do and how to embrace maybe a new opportunity. My son Uriah is very much introverted, but he's a really good soccer player and he is kind of like a servant. He's very humble. And I think the coach kind of hinted like, he needed a team captain. And my son was like, I hope he does not pick me. And I'm like, what? I was like, that would be an honor. Like, what do you mean? And he's like, I really hope he does not pick me. And I was like, you know what, Uriah, like, I know that you don't think of yourself as a leader and that's what you think. And I get it. But do you think that God might want you to be the leader? I said, can you pray about it and just ask him? And then he's like, I do think that God might want me to be a leader. And I was like, okay. I was like, so he's like, but he goes, I'm not outspoken and I'm not, I'm not the typical person you would want to choose. I said, you know what? Your coach chose you for a reason. And you just have to be you, and you have to just, you have to be you. And so, yesterday he got the team captain armband and I looked at him and he was like, I'm going to wear this, Mom, and I'm going to be the captain, but I'm going to do it my way. And I said, that's perfectly fine. You know what I mean?
Exactly.
But I had to encourage him that you might not think that you are, but people see it in you and sometimes those doors open. So I would just encourage that person just to walk through the door and see what God does.
Yeah, exactly. Because exactly, it's not a perfect formula. There's not just one box, that kind of person is a leader, that type of box, it's playing on your strengths, God's calling, and the right opportunities. And and leader is not just boxed into one kind of person or type or trait. It can definitely be anyone. as long as you're willing to be that servant leader to really effectively bring about change and help and hope to the people around you.
Yes.
And so thank you so much, Denise. I really enjoyed our conversation, and I am sure that others will be inspired and encouraged by this conversation. And it is just such an honor and privilege to speak with you. And thank you so much for coming on the podcast, Denise.
Oh, thank you for having me. I was so nervous, but as we started talking, the nerves kind of went away, and I'm happy and honored that we had this opportunity to have this conversation. And I know that, the work that you're doing is blessing others, and you had to step out in faith and be a leader in this and doing this podcast. And so just thank you for being obedient and walking your journey. So thanks a lot.
Thank you so much. Thank you. And thank you all so much for listening. I hope that you can spark hope in your communities, in your families, and find those leadership qualities within you and shine. Thank you again. We'll see you next time. Thank you for joining us on this episode of Medicine, Motherhood, and Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you've enjoyed today's episode, be sure to subscribe and follow us, leave a review. Your feedback helps us improve and reach more listeners like you. Follow us on Instagram and all the socials. We'd love for you to join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, whether you're balancing the demands of a medical career, navigating the joys and challenges of parenthood, or dedicating yourself to a cause greater than yourself, you're not alone. We're here to support you, celebrate, and inspire one another on this incredible journey. Until next time, keep healing, keep nurturing, and keep sparking hope. This is Johanna signing off from Medicine, Motherhood, and Missions.